Chronic hiccups typically occur because of two structural abnormalities. Both are caused by ligamentous cervical instability. Upper cervical instability can cause the atlas to move forward, compressing the carotid sheath, injuring the vagus nerve. That's one cause. Middle cervical instability, ligamentous cervical instability, can cause a narrowing of the nerve roots through which the phrenic nerve is made, and the phrenic nerve innervates the diaphragm, and hiccups are caused by involuntary contraction of the diaphragm.